you already have the introduction. I have the misfortune of being the last speaker, so be a little patient, and I'll try to make it as interactive as possible so that you can say a lot during the lecture. But please be a little disciplined so that we don't go off the subject. Okay? So the subject is breastfeeding and weaning practices. So to begin with, I would like to ask generally that why breastfeed? दो चार कोई बताइए, especially the ladies in front.
A big advantage is the amount of antibodies present in the breast.
Right, very good. So as to protect the baby from infections, because there are lots of antibodies. Very good. They are ready-made, easily available, readily available, and with very little cost. जी आप next slide कर दें जरा जी. Right, उससे bonding बढ़ती है, bonding. So our first question was why breastfeed? आप दिखाइए next. Now जैसे आपने फरमाया था, the first thing is there are benefits for the baby and for the mother. And as it is a practical approach, I won't go into details of benefits to the country and all that thing. But looking at this, look the benefit to the baby. There is better mental development. Now this is a very, very important thing, because milk is species specific. That means milk is made for a certain species. In a human baby, the brain has to grow more than the body. So there are ingredients in this which have better development of the brain and of the psyche. The milk of a buffalo is made for a calf of a cow, and the cow is going to grow physically and less mentally. Cow is not going to go to school. A human baby has to go to school. So this is a very, very important thing, because all your formulas do not provide these ingredients for the brain growth. Then protection against air infections. Air infections are very, very common. Very common in bottle-fed babies, because the milk goes into the eustachian tubes and it causes allergies, irritations and infections. Better mouth formation and straighter teeth and no caries. A baby who goes to sleep with a bottle in his mouth is going to have lactose on his teeth and have bacilli and have florid caries, and you do see a lot of caries in bottle-fed babies. Protection against chest infection and wheezing, and it is seen that breastfed babies have 1/3, or rather bottle-fed babies have 3 times more chest infections as compared to babies who are breastfed. Low risk of diabetes, because it was seen that diabetes, infantile diabetes, was more common in the West than over here. There's a genetic difference, and the cow's milk allergy sometimes hits the pancreas and causes diabetes. Protection against diarrhea, gastroenteritis and tummy upsets. A baby who's fed on a bottle is 25 times more likely to die of diarrhea as compared to a baby who's breastfed. Less smelly nappies because of lactobacillus, less eczema and skin infections. Less likelihood of cot death. You know, cot death is sudden infant death syndrome, SIDS. SIDS is more common in, or rather it is not seen in a breastfed baby. Cot death means the baby is healthy, you put the baby to sleep and the baby doesn't wake up. Sudden infant death syndrome. Cheaper than bottle feeding. A breastfeeding mother needs just 500 extra calories from the kitchen. and you can calculate the cost of 500 extra calories. Whereas if he is fed on formula, it's going to cost around 2,500 to 3,000 rupees per month on a formula, and on other milk it will be a little cheaper, but you will have problems of dilution or all this in other milks also. Mother also, when you look at all this, sometimes the mothers feel कि हमें क्या फ़ायदा है. Although when any female becomes a mother, first thinks of the baby, but mother also has some advantages. There is low risk of menopausal breast cancer, stronger bones in later life. You know, as a young medical student, I used to think that osteomalacia and all this is due to breastfeeding. But now it is seen that these women who breastfeed have less osteoporosis and faster return to pre-pregnancy figure and lower risk of ovarian cancer. There is also a false feeling among some ladies that breastfeeding probably spoils their figure. It is the other way around, because after pregnancy, if a mother is breastfeeding, there is going to be involution of the uterus is faster. The uterus becomes smaller very quickly because of release of oxytocin, and those 5 or 6 kgs of fat which was laid down for breastfeeding along the lower abdomen and on the buttocks is going to be utilized if the mother is breastfeeding. So actually it is, you've never seen a village woman who is obese, because she breastfeeds, she puts something on her head, the curvature of the spine is very good, and she never has an obese belly. So these are a little bit of the benefits. So why we say why breastfeed, and that should have been first to add on that for Muslims, Quran says a mother, to perfect her breastfeeding, she must feed a baby for 2 whole years. So ये एक दीनी फरीज़ा भी बन जाता है breastfeeding. जी. When the mother is feeding the baby, there is lot of oxytocin release and prolactin release, and prolactin depresses ovulation. And you gave a very good point, because it is seen that breastfeeding, exclusive breastfeeding for 6 months and continuous breastfeeding for 2 years gives more family planning, more protection against pregnancy as compared to other family planning methods. All of them have a failure rate. So does breastfeeding. But look at the cost we have in introducing alien family planning methods, and this is the family planning method which is naturally and maybe according to our religion and according to our culture. So do our mothers, do I have to teach breastfeeding? Do you have to teach breastfeeding? Do our mothers know breastfeeding? Ji? They know? They have to be taught. I think they know. They don't practice, they don't have the modern practices, I would say. They know how to breastfeed, and we have all survived because of this, the races, right? So next slide please.
They don't know the benefits of breastfeeding.
Yes. They know the benefits. Most mothers tell me everything which I know, most of it may not be scientific. जी इससे अच्छा कोई दूध नहीं, इसमें कोई मिलावट नहीं. You see, in their own language they know a lot, and you will see here that almost 100% start breastfeeding. So नियत भी है, करती भी है. लेकिन next slide दिखाएं please. But the result should have been better. Look at this acute malnutrition in Pakistan. This 0 to 6 months, अगर 98% of them are breastfeeding, why this? कोई बता सकेगा? अभी आपने देखा है ना कि 98% वो ब्रेस्ट फीडिंग, लेकिन ये फिर क्यों है जी? उल्टा देती हैं, छुड़ा देती हैं, राइट, क्वाइट राइट, कि ऑप्टिमम ब्रेस्ट फीडिंग प्रैक्टिसेस उनकी नहीं है, पूरा फ़ायदा नहीं उठाया जाता, राइट? एंड व्हाट अबाउट दिस, ये क्यों है? एक साल पे देखें, इट्स 12%. Poor weaning practices. This is due to in first year and second year, and goes on. Then it starts to fall a little for those who survive. The ones who don't survive fall out of this count. तो ये वाली क्यों है? You will see it in the next slide. दिखाइए जी. अब 100% start breastfeeding, right? But only 20% feed exclusively. That is the difference. By exclusive breastfeeding, I means only and only mother's milk. No water, no gutti, no other milk, no arak, no animal milk, nothing. So only 20% begin like this. Then it starts to fall. So it is this reason which is, and this gap which is giving you that much malnutrition. They breastfeed, they begin breastfeeding, they want to breastfeed, they know this is the best thing, but they don't know the best benefit is from exclusive breastfeeding, only and only breastfeeding, right? So let's look into this, that why do we have this, and why not exclusive from here? Next दिखाएंगे. Now these are the concerns which are affecting our children a lot. Pre-lacteal feeds are given to all newborns, almost all, because only 20% are doing exclusive. Pre-lacteal का आपका मतलब आप समझते हैं ना, is just before starting to breastfeed. कोई घुट्टी देते हैं, हम हनी देते हैं, हमदर्द की घुट्टी देते हैं, और तरह तरह की लोकल बनी भी घुटियाँ भी देते हैं. So these are known as pre-lacteal feeds, and they can give infections. Colostrum is thought to be dirty and stale, and it is thrown away. And it is very funny that colostrum of animals is presented to the best of friends and relatives, but colostrum of human beings is thrown away. So ये अशरफुल मखलूक़ात हैं हम, and this is our thinking that should be thrown away. And this is very common in the villages where 70% of our population lives, because this is thought to be that it was there for so long. And colostrum has a different color because it has a lot of proteins and vitamin A, so it has a different color. They think कि ये सही नहीं है. So they take 3 days for milk to come in, they take another 3 days for colostrum to go away, and in 1 week's time baby has had all the bacteria and viruses in the world. So that is the reason for the malnutrition. Exclusive breastfeeding is rare, as I have told you. Water is given to breastfed babies, and this is argued with specialists, with people with post-graduation, and they all feel that it is so hot, we have to give water. So, and they talk about this, you talk of all the researches in the West, but this research has been done in Lahore, in New Delhi, everywhere, that babies who were breastfed, totally breastfed, had the same concentration of urine as compared to babies who were fed on water also, because human milk has 87% water. So there is no need to give water. Even in the month of June, even in a jhuggi where there is no electricity, there is no need to give water, because mother will feel thirsty, she will drink more water and maintain 87% water in her milk. Early supplementation milk feeds are common. बहुत लोग सोचते हैं कि माँ का दूध भी दें, दूसरा भी दें, दोनों तरफ से फ़ायदा उठाएं. You know, human nature is such, 99 का फेर, हर चीज़ से फ़ायदा, हर चीज़ से फ़ायदा. So they feel के there was one lady who said कि हमारे घर तो इतनी भैंसें हम क्यों ना दें. So this is what they don't realize, that this is going to make the baby ill, and we will discuss later on all the problems with giving supplemental milk feeds. So due to all this and due to the formula milk industry, duration of breastfeeding is declining and feeding bottles are commonly used. These days I am working in a hospital, social security hospital, where we have only the labor class, and their family earning is about 4,000, 5,000, and each mother wants to feed on a bottle. Why? Because the medical staff is not educated to know what is the fault which lies with these, and they are the ones who say अच्छा अभी दूध नहीं आ रहा, जल्दी से बोतल ले आओ. तो हर चीज़ का जवाब जो है ना वो बॉटल है. And when that is the only hospital which, and she's there, which did not take part in BFHI, you know, was breastfeeding, hospital breastfeeding initiative, baby friendly initiative was BFHI. So they didn't take part in this. That was about 10 years ago, and all the hospitals took part, and most of the government hospitals have some sort of baby friendly activities of not using the bottles, at least in the hospital. Next. So in optimum breastfeeding practices, we say the baby should be put to the breast as soon as possible, within half an hour of delivery, and within an hour of delivery in a case of cesarean section, as soon as the mother comes round. So why do we want to put the baby to the breast within half an hour? What are the advantages of the early initiation? The baby, most of you must have seen a newborn baby. A baby is alert. When he is born, he is crying, and he has a strong suckling reflex. There was a research which showed that if you put the baby near the mother, near her tummy, skin to skin, the baby is going to move itself towards the breast. The suckling reflex is so strong at that time. Unfortunately, we miss that time in bathing the baby and dressing the baby and cleaning the baby and giving the baby to the relatives to be seen. So this thing is lost. Baby gets, if he is put to the breast, immediately he gets colostrum. You know, when the woman, when the lady is on the delivery table, आपके कब्जे में, ठीक है? Once the relatives come in, then cultural things come in. So before the relatives come in, if you put the baby to the breast, the baby goes to the relatives after getting colostrum. And you know, milk has WBCs, macrophages, polymorphs, which engulf bacteria. So if the baby has had colostrum first, and if he gets bacteria later on, that bacteria will get caught by the colostrum. When you put the baby to the breast, skin to skin with the mother, it prevents hypothermia. You know, the baby's system is immature. He cannot maintain his temperature. He is affected by the environment and gets cold very quickly, even in summers, and he needs to be kept warm and wrapped up. So mother skin to skin contact prevents hypothermia, and then, as you said, promotes bonding. Bonding is a special relationship between mother and baby, which is different in animals and different in humans. Animals में भी आपने bonding का कभी देखा तरीका? When a calf is born or a puppy is born, the mother starts to lick, and she licks and licks and licks for hours, and that is the skin to skin contact and bonding. But animal bonding is different. You know, the mother and baby forget each other in a year or so, in a few months. But human bonding is very different. The relationship between the baby and mother lasts forever. And it is seen that bonded mothers, that means those who breastfeed and are bonded with their babies, never abandon their babies. Whereas mothers who have never had skin-to-skin contact, or babies in the West you have seen, they can walk off with anybody leaving the baby. Whereas a bonded mother, ससुराल से लड़के भी जाती है तो बच्चा बगल में ले जाती है. So that is bonding. She doesn't want to leave her baby at any cost. And this bonding is very, very active in the first few hours when the mother sees the baby for the first time and puts the baby to the breast. So we say initiation should be within half an hour, and mother and baby should be skin to skin for half an hour. And those mothers who have early initiation, there is a prolonged duration of breastfeeding. And if you miss that period, for example, in C-section babies, there are many relatives who say कि जी तीसरे दिन पिलाएंगे, चौथे दिन पिलाएंगे, then they have a lot of problem. And the suckling reflex is not so strong. The baby has gotten used to the bottle. So these are the problems. Next slide, please. For the mother, the advantages are: it stimulates oxytocin release and helps if the baby is put to the breast on the delivery table. In some African tribes, the baby is put to the breast before the cord is cut. If you are in a place where there is no medical help and there is postpartum hemorrhage, you need oxytocin, pitocin drip. The best drip is put the baby to the breast. The baby starts suckling and there is a release of oxytocin. And this helps in delivery of placenta and prevents postpartum hemorrhage and helps in uterine involution, as I told you earlier. Next. Now, what are the effects of optimum breastfeeding practices on the baby and on the mother? If the baby starts to suckle early, suckling is frequent, vigorous, effective, that means breasts are emptied at both breasts for sufficient time, there is going to be a good letdown reflex, more milk productions, and if the baby feeds for a sufficient time, he gets more hind milk. You know, there is a difference between foremilk and hind milk. Foremilk is watery and hind milk has fat. So hind milk is very important for the baby to get the calories. And when he gets all the calories and the fat, there is satiety and he gives up the breast. That's why a breastfed baby is never obese. He never overeats. And as soon as he gets hind milk, he lets the breast go and he is satisfied. So these are the things. The baby produces good milk supply when the baby is put to the breast properly. Next slide. When there is a good milk supply, the baby is satisfied, he grows well, and he is motivated to breastfeed. Mother who has a good milk supply is very confident. There is a lot of difference in the mother whose baby is feeding well. Her face is very different. She is happy and she is very confident, comfortable, there is no pain due to engorgement, and she is motivated to breastfeed more. So a good milk supply motivates both baby and the mother to feed more. And for a good milk supply, you need a good suckling. Next. Now, why are we so keen? No prelactal feeds, no prelactal feeds, because you know that they can cause diarrhea and other infections. Ghutti can act as a purgative which can lead to early expulsion of meconium. You know, meconium is a protective substance. It has been there for so many months. We want to get rid of it, but not very fast, because it is protective, it protects against bacteria, but we don't want it to stay in for long. Then it is going to give more jaundice. So, but breast milk is a good purgative and has a good gastrocolic reflex, and there is reasonable expulsion of meconium. But ghutti can cause problems. Most of the ghuttis have some diarrheal element, because the idea is to get rid of the meconium, and then in some babies it can cause severe diarrhea. Cow's milk can cause allergies, and you all know cow's milk allergy is quite common. Prelactal feeds can cause nipple confusion if given in a bottle. By nipple confusion we mean if a baby is fed in a bottle, the teat is different from the breast and the reflex is very different. When the baby takes milk from a bottle, what happens? You shove the bottle in the baby's mouth, a few drops fall at the back of his mouth, there is a gagging reflex and he starts to suck. When the baby feeds from the mother's breast, he takes the whole of the nipple and areola to the back of his mouth, and then he presses this against his palate by his tongue and milks out the milk. So the two reflexes are very different. So if you put the bottle in the baby's mouth and the breast in the baby's mouth, he gets confused and he refuses to take the breast, and we call this nipple confusion. Next please. Now, exclusive breastfeeding is defined as total breastfeeding with no prelactal feeds, no additional water, herb water, sharbat, tea. Tea is very popular. और क्यों पॉपुलर है कि ये हाजमा करती है. Mothers put tea in the bottle and feed. इससे हाजमा होता है. Actually, tea reduces appetite and sleep. So that is the worst thing for a baby. No supplementary fresh animal milk or formula feeds. No semi-solid foods. This is exclusive breastfeeding, and our modern thinking is that baby should be fed exclusively for 6 whole months, for first 6 months. Next. अब अक्सर कहते हैं पानी तो they want to give boiled water, distilled water, mineral water, but what are the disadvantages of feeding water? Can be contaminated and a source of infection. It can interfere with optimal breastfeeding because it reduces suckling, and अगर पेट भर जाए पानी से, baby doesn't want to suck. So suckling time is reduced, milk production is also reduced. And then if it is given in a bottle, it causes nipple confusion. So even water in Lahore or in any hot place is not recommended. There was a time we used to give lot of water for physiological jaundice. And then this came in that water is bad and water should not be given. I remember myself in Gangaram, there was a lady who told me, I came last year and last year you were telling me have lots of water, your baby is jaundice, he has a fever, and now you are telling me not to have any water. I was quite embarrassed, but I had to tell her that these are researches and you come to a hospital to know modern things. There was a time we used to give a lot of water to prevent fever and physiological jaundice, but now water is not. जी डायरिया हो जाए तो आप ब्रेस्ट फीडिंग बढ़ाएं, बिकॉज 87% वाटर है उसमें, ठीक है ना. अब हम डायरिया में एडल्ट्स को भी सिर्फ वाटर तो नहीं देते ना, ORS देते हैं ना, जिसमें सॉल्ट्स भी हों, तो इसलिए बेबी को भी वो वाटर देने का बिल्कुल कोई आइडिया नहीं. वी गिव फीड द बेबी मोर. नेक्स्ट. देन डिमांड फीडिंग. व्हाट इज डिमांड फीडिंग? You ask a baby, when do you feed? You ask a mother के कितनी दफ़ा दूध देती हो? When do you feed? जदों मंगदा है. She knows demand feeding, that we feed according to the demand. So that's why I was saying that our mothers do know breastfeeding, but they need to be directed a little more. So demand feeding is whenever he cries or mother feels a need to feed. How does a mother feel a need to feed? Is when she feels engorgement in her breast, she knows this is the feeding time, or the baby cries for it. To begin with, they feed irregularly, some very often, some less, but within 2 weeks they settle into a routine. A newborn baby may feed every minute, may not feed for 2 hours, it's a little irregular, but by 2 weeks they settle into a routine. And we recommend that there should be frequent suckling at least 8 to 10 times a day, and during the day and night, and this is going to have good milk production. Now, by meaning at least, that doesn't mean not more than that, at least 8 to 10 times. Sometimes newborn babies feed 40 times, but they feed every half an hour, every 15 minutes, because they go to sleep easily. Scheduled feedings, जिस तरह है कि every 3 hours or every 2 hours, are not the modern thinking in breastfeeding. To begin with, it should be a demand feeding. A sleepy baby should be awakened to have at least 8 to 10 feeds in 24 hours. These newborn babies, sometimes they sleep for 5 hours, but when they wake up, they feed continuously for 3 hours. So total should be at least 8 to 10 feeds. Next. What are the advantages? Why do mothers say we feed according to their requirement? It prevents engorgement and mastitis. In most postpartum wards, where in the hospitals, this doesn't happen at home. More problems are in the hospitals. More problems are caused by health workers, whatever may be their level, because they have scheduled feeds. Sometimes the baby is in the nursery and not with the mother. So mothers are likely to have engorgement. This is the most common problem in the ward. Breastfeeding problem is engorgement. And if you don't relieve that, she can have mastitis. Demand feeding keeps the baby satisfied, promotes growth by providing adequate nutrients and preventing infections. It is critical for child spacing effects, जो अभी आपने किसी ने कहा था, and that's why we encourage night feeding, because if you want to take advantage of the prolactin level, it must be maintained, and mothers should feed at night at least 2 times or 3 times. And remember, when there is in bottle feeding, we discourage night feeding because most of the accidents take place when the mother is half asleep. But when the mother is breastfeeding, there is no accident. She can breastfeed 3 times, 4 times at night. Next. What are the advantages of night feeding? Sustains a milk supply. It is useful for working mothers who have less chance to breastfeed during their day. Now sometimes some people say this is too hard on working mothers, that they should feed at night and work in the morning. It is, तो पाँव के नीचे जन्नत यूँ ही नहीं आती. It is hard, there is no doubt. But most mothers, they learn to breastfeed while half asleep. They can breastfeed lying down. जो बॉटल में मना करते थे ना, कानों में दूध चला जाएगा, that doesn't happen in breastfeeding. She can feed lying down at night. And this helps to ensure 8 to 10 times feeding in 24 hours, and it is more convenient than preparing bottles at night. At night, when you are preparing a bottle and the baby is crying, the whole household is upset. Everybody wakes up. But if the mother doesn't have to do anything, she just has to start feeding the baby whenever he whimpers or cries. That saves a lot of night rest for the rest of the family.
अगर वो वर्किंग लेडी है तो 6 से 8-10 घंटे तो वो बाहर रहेगी, उस वक्त क्या करें?
मैं आपको वर्किंग लेडीज़ की भी बताऊंगी बाद में. Let's leave that question to the end. This is a very good question and very apt for especially our profession. Next. Now, they say how long should a baby should feed at each breast? According to baby's demand. When the baby is satisfied, he gives up himself. Slow feeders can be stimulated to feed longer to make sure they get hind milk. It is very important to give hind milk because all your cholesterol and all the goodies are in the hind milk, and water is more in the foremilk. And it is really remarkable how milk of one mother differs from the other. ये हाइंड मिल्क से आया कि आपने कैंगरू देखा है? कैंगरू का बच्चा पहले पॉकेट में रहता है. When he is in the pocket, they are सेवरल टीथ्स, 2 टीथ्स नीचे हैं, ये पॉकेट में होता है, ही फीड्स फ्रॉम दैट, और जब वो पॉकेट से बाहर निकलने लगता है, बड़ा हो जाता है, फिर वो ऊपर वाली से दूध पीता है।